Today, I'm in the Offenso North District of the Ashanti region. Okay. What should I take? Okay. All right. I am here to visit a child who is malnourished. 3 months old Ericatia weighed 2.3 kilograms when she was born, but now she weighs 1.9 kilograms. Is this like the most extreme case you've had so far?
We have had others, but I think he's the surviving one. Others too recovered. Yeah.
She's a girl.
She's a girl. The mother is a GHS liver, yeah. And the daddy too the same. As we calculate, first of this month is a third month.
And her birth weight
is 2.3 kilogram. Yeah. Mostly when you fall below 2.5, you are advised on how to take care of the child critically so that the child doesn't become malnourished.
Ericatia died 10 minutes after I left her home.
Madam Pat,
please breastfeed her. She's looking too weak.
Okay, hold her carefully.
Okay.
She doesn't like it.
What am I now?
She's weak, very weak.
Please wake her up. She's awake, but her eyes are not looking good at all.
Her parents did not consider seeking medical help because they believed she was suffering from a charm called Asram, placed on her before birth. Though Patricia recalled she was not born well and hearty, she resorted to bathing Ericatia with herbs because of the supposed charm. This is just one of the many cases in the Offenso North District here in the Ashanti region. Now, the district has recorded about 61 of such cases.
Is this your first child? No.
Second one.
She's the second. How different was her birth from the first child? My first birth was through cesarean section, but this one was through natural birth.
I want nana home fan. Am I to home 3 weeks?
We were admitted for 3 weeks because of her health. While in the hospital, they didn't allow me to breastfeed her for 3 days. They told me she was on medication. 4 days after giving birth to her, they allowed me to breastfeed her. She's still not well, so we bath her with some herbs.
Why
do you bath her with the herbs? What can the herbs do to improve her feeding? They gave me some medicine from the hospital. I was told to stop giving after 7 days, and I did.
Because of
seeing her like this makes me sad.
Richard Owusu-Danso is the nutrition officer in the Ofinso North District. He said between January and August 2015, he had to manage over 60 malnutrition cases.
Most often when they are giving birth to at that birth weight below 2.5, mostly they do stay in their house for 40 days. And then when they come for weighing, as they usually used to call it, what happens is when their weight is being seen to be declining and they are asked, all that they used to say is astram. But mostly not all these cases are astram.
What is astram?
Astram is a condition whereby traditionally it is seen that somebody has given a spiritual infection to their child to either deteriorate in weight and development. So at the end, they expect that you have to bring the child to whoever gave that spiritual disease to that child. So at the end of the day, the one healing the child will have to collect a token, which will be something like an income to the person. So it is a deliberate act just to ensure that they also get something to spend on their family. So that's how it happens. However, I think what we have realized is that Asram, mostly those people, it is said that they don't reveal themselves. You have to go around looking for these spiritual healers to help you. And if you are not able to identify that person who gave that condition, that is whereby the child pass away easily because of that spiritual disease. But health, in terms of health, I think we don't believe in astram. We believe that if the child is properly fed well, breastfed well, within the first 6 months, the child will recover from whatever condition the child is facing. So mostly the community used to think that it is astram. So they report lately to our facilities, which doesn't ensure proper health care, which they are supposed to benefit earlier on. But when they come, we try as much as possible to support them in all direction that we are supposed to.
Amazing. So right now the situation is that people are of the opinion that even people are jujued virtually to become malnourished. Amazing. Okay. Now can share me first say now what do you have?
You told me earlier that you bath her with some herbs. Is it because you thought someone bewitched her? Some people advise me to use medicine for her.
But
your free hospital by a nanny started a dear during Jaranessa. Every sinner.
Ain't we the bene last time ultimididi on
when was the last time she ate properly?
Enano piano. Would you an opaid dear no would you now?
This morning she ate very well.
Why?
Okay. I don't know, but I realize the hair. So she's a girl. Her tongue is white.
Why?
Give me a clear description of how a malnourished. Yeah.
The child is currently anemic. It's now anemic. The child is wasted. When I say wasted, the bones are easily visible. You can see the bone visible without even feeling with your hands. And the child is also underweight. That means that the child, I'll call it, the child is totally malnourished. That's what I'll call it. So the child, I'll say the child is having this condition we call marasmic. Yeah. Okay. And anemic as well. So that's why the child's tongue is a little bit pale. You can even see the skin to even show that the child is pale. That means the child does not have enough blood circulating the body. Yeah.
According to the United Nations Children's Fund, UNICEF, malnutrition accounts for 1/3 of all child deaths in Ghana. More than 1 in 5 children in the country suffer from chronic malnutrition, and 57% of those under 5 years are found to be anemic. UNICEF is supporting the Ghana Health Service to scale up community support to improve infant and young child feeding practices in all 10 regions of the country. It is hopeful that this will reduce the number of malnutrition deaths in Ghana.